7 o'clock, so maybe I'll just chat for a minute. And Sarah, you'll let other folks in if they come knocking. Welcome to Hot Topics. This is a series of just really informal Zoom meetings that we initiated last year when we had to plunge into the virtual environment for recruitment and interview season. And it was very well received. So we decided to do it again this year, because we're doing virtual interviews and recruitment all over again, and B, because we got pretty good feedback about it. So we usually just, again, it's really an informal time to share little tidbits about our program or other aspects of family medicine, and then give you guys an opportunity to ask questions of any of our residents that are on. So right now, Marco is in the hot seat as our resident who's joined us, or of me. So I'll just introduce myself, and then I know some of you already introduced yourselves, but maybe we can have you guys introduce yourself, and then I'll tell you just a little bit about our topic tonight. So my name's Kirsten Johnson Martin. I am the Director of Osteopathic Education for our residency program. Today actually marks my 2-year anniversary of being on faculty, but I graduated from the program in 2007, and then I stayed in Lancaster and worked at a local federally qualified health center for 12 years in practice and as a medical director and ultimately the chief medical officer, before I decided that it was time to dabble in academic medicine. And so came back into the program 2 years ago as the Director of Osteopathic Education, and trying to kind of head our journey towards osteopathic recognition. So for those of you who are in allopathic programs or MD programs, the ACGME and the AOA combined forces last year to have a combined match, and now MD programs previously had something called what they would be dually accredited, and so now the new lingo is to be an ACGME accredited residency program but obtain osteopathic recognition for the program, which has extra emphasis on osteopathic principles and practice, and incorporates osteopathic manipulative treatment education for all residents, MD and DO alike, but also offers kind of enhanced OMT and osteopathic principles and practice, which we call OPP, training for our DO residents who may be, or even MD residents who may be interested in getting additional certification in osteopathic manipulation. So that's my charge. And I in addition to the osteopathic stuff, some of my own clinical interests are maternal and child health, and refugee health, global health, and substance use disorders. And I am a full spectrum family practice doc. I do outpatient medicine, inpatient medicine, and OB. That's me. Maybe you guys want to just introduce yourselves, and then I'll just tell you a little bit more about what we do for OMT and OPP, and then we'll just kind of chat.
Real quick, KJM, your lovely earrings are smacking against your headphones, and then sometimes you cut out when there we go, perfect.
Thank you. They're not made by Sarah, although Sarah does make beautiful jewelry.
Thank you.
So Rebecca, do you want to just introduce yourself real quick? I'll kind of go across how I'm seeing your names show up.
Sure, no problem. Hi, everyone. My name is Rebecca Wynn. I'm a 4th-year medical student at New York Medical College. Family med all the way, which is really exciting. I'm from the Hudson Valley area, and I'm excited to learn more today.
Awesome. Marco?
I'm Marco. I'm one of the interns at LGH. I'm originally from Virginia, and I went to med school at VCOM. And I'm really enjoying residency so far at LGH. So you guys should definitely come here.
Thanks, Marco. Joshua.
Hey everybody, I'm Joshua. I'm a fourth year medical student from Thomas Jefferson. I enjoyed my family medicine rotation as a third year, and that really solidified my choice. I'm actually from York County, Pennsylvania. It's just a hop, skip, and a jump from Lancaster, and I've really enjoyed these sessions. I thought they've been very informative.
Awesome. Thanks. James.
Hey guys, I'm James. I'm also a fourth year at Jefferson, but I was born and raised in Philly, so not too far away, maybe an hour, 2 hours away from you guys, but would love to check it out. So excited to be here.
Great. Sarah, you want to introduce yourself? You're next on my list.
Haha. I'm Sarah. You've probably been on other the Hot Topics calls, so you know that I'm a loudmouth. But I'm the unofficial tech support and residency program representative. So pretty much anything random that you would need with the program, you would come to me. And in the meantime, if you have any questions, I can set you in motion to talk to the right person.
And she makes cool jewelry. Brian Talbot, I see your name next.
Hi, everybody. I'm Brian, MS4 from Albany Med. Also definitely, applying into family med and really excited about it. And excited to be here and learn more. So thanks for having me.
Awesome. Welcome. And I see Charisse Hamblin, Dr. Hamblin.
Hi, I'm on call at Women and Babies, but I was like, I wanted to actually just make sure I didn't make it so no one could get to the meeting tonight. So I'm glad that everybody was able to get in.
Nope, you're awesome.
You haven't hijacked our system. I think did I get everyone? I don't see any other names. So Dr. Hamblin is one of our OBGYNs. So we have a pretty collaborative, very collaborative relationship. We do family medicine obstetrics, but we have I don't know, 7 or 8 OBs who are part of our team that provide 24-hour backup coverage. And we have really a shared model of care for our OB patients. And so it's just a great relationship. And Dr. Hamblin is also our diversity, equity, and inclusion officer. So yay.
Yes. I'm not going to stay because we got a couple of things happen on the labor floor, but I did want to say thanks for coming. And it's nice to see your lovely faces and make me remember how it felt to be a fourth year med student. I actually didn't do any of this and none of it. So anyway, enjoy the session and yeah, take care, guys.
Thanks,
Bye, Dr.
Sheree.
Hamblin.
Bye.
All right. And actually our program director, Pam Vanenchek, is also on OB call. So she's the family medicine doc who's on OB call tonight, and Charisse is the OB backup. So just real briefly about our OMT and OPP curriculum. So as I mentioned, I was brought on about 2 years ago to start developing the curriculum. We have not yet submitted our application to the ACGME for osteopathic recognition. I would like to say we're pretty shovel ready though to submit it in the near future, but we are recruiting for another osteopathic physician to join our faculty so that I am not the sole DO with all of the responsibility for all of the osteopathic education. So if you guys know any DOs who are interested in academic medicine, send them our way. But it's been really fun to kind of go back to my roots and bring osteopathic education to a program that I'm really proud of and so glad that I went through myself. At the time that I went through it, there was one DO who was doing an academic faculty development fellowship at the time who was a sort of a mentor for me. And there was one other DO in my residency class out of 13, but there wasn't structured osteopathic education. And that's really what I'm trying to help develop now. And the goal is that, you know, like I mentioned before, our osteopathic residents have a venue to continue honing their skills and using osteopathic manipulation as another layer of treatment that they have to offer to our patients for musculoskeletal complaints primarily, but we also treat respiratory complaints and headaches and sinus issues. So a whole gamut of things. And then also kind of elaborate on the education component with osteopathic principles that really kind of combine that body, mind, and spirit connection. And it's been a nice complement. We have several areas of concentration in our program. You guys probably have heard of those in other places. One of the areas of concentration is integrative medicine. And actually one of our current second year residents, who is a DO, is interested in developing a new area of concentration specific for osteopathic manipulation. So I'm really excited to be working with her on that. But the integrative medicine folks kind of tap in a little bit extra to some of the osteopathic manipulation opportunities. And our MDs are learning OMT, which is a lot of fun. So what we do now is have OMT clinic every other Thursday at our urban office. Once we have a second faculty member, we'll also start OMT clinic down in our rural office. I don't know if you guys know a ton about our program, but we're one of the only programs in the country, or maybe the only program in the country, that has two very distinct clinical practice locations. So in your first year of residency, you do all of your continuity clinics at our urban location in Lancaster City. And then as you're going into second year, you start to have a continuity clinic in it's only 16 miles away. It takes about 25 minutes to get there, but it's like drastically different from our urban clinic. So it's down in Quarryville, Pennsylvania, down south. So it's really nice to have those two different clinical practice environments. Up in the city, I think folks see the breadth of family medicine from birth to death in all ages, but they also tend to have a lot more child checks and babies and prenatal care, a little bit of a younger population, probably racially and ethnically and socioeconomically more diverse. Down in the South, it tends to be kind of a lot of more adult medicine, I would say, although they do see full spectrum family practice down there. But there's folks who haven't been to a doctor for 7 years and walk in with, like, their arm hanging off. So you get to do lots of procedures down there and be that country doc. So that's a really cool aspect of our program. But in terms of OMT clinic right now, it's only in the city every other week. And I precept or run the majority of those sessions, but we do have another community preceptor who's a former colleague and friend of mine who helps out sometimes, who's a DO from, he went to Philadelphia College of Osteopathic Medicine. I trained or went to school at Lake Erie College of Osteopathic Medicine. And depending on what rotation you're on, you get assigned to OMT clinic. Our DOs get assigned to some extra OMT clinics, but everybody gets assigned at least once or twice in their first year and then also in their third year. And as we're adding more OMT clinics down in Quarryville, we'll probably also have some second year time in OMT clinic. And then we do things, we have didactic sessions every morning for half an hour from 7:30 to 8. And some of those morning report didactic sessions about 4 to 6 times a year have osteopathic content. And it's sprinkled throughout some of our all block conferences, which are also didactic learning. And eventually, I hope to also have an inpatient consultation service and also be doing OMT on a regular basis on the labor and delivery floor, which I'm super stoked about. So that's my spiel. I'm going to stop talking. I said too many words. So I don't know, Marco, if you have anything else you want to add, and if not, we'll just open it up for questions and comments from our friends.
Yeah, I think questions would be great. If you guys have anything you want to learn more about, feel free just to let us know.
And it doesn't have to be specifically to the osteopathic stuff. You can ask anything. You can ask about our cafeteria or anything you want.
I just have a question actually for Marco. Marco, did you go to an allopathic school or an osteopathic school?
No, I'm a DO, so I went to an osteopathic school.
I think you probably, I love it. My question is for your colleagues that went to an allopathic school, how do they talk about OMM? Is it difficult to pick up and kind of integrate their principles into their everyday practice when you go through 4 years really not hearing much about OMM?
Yeah, so a lot of my friends in my class who I have the most interaction with are all really curious about OMM because, like you said, it's not something that they learned in school. I've seen a lot of people who want to learn more, and I've actually shown a couple of them a couple of techniques that we used quite a bit when we were learning in school. We haven't actually had our OMT conference yet for this block, I don't think. So I'm excited to see what that looks like and hopefully help my colleagues learn more about it. But the relationship is really congenial between the DOs and MDs. Like, it's not anything that people struggle with or anything.
I think now that our MD residents know we have DOs with skills with their hands, at night on call, they whip out the tables and ask for ask for treatments, and yeah, they're getting some freebies. They practice on each other, and I know this because we have 2 portable tables and they live right behind my desk, so I can always tell when I come in the morning whether somebody's been working in the wee hours of the morning or overnight. I will also say too that before anyone comes into OMT clinic, there's actually like a 20-minute video that's a really brief introduction that I've pre-recorded that lets residents just kind of get the basics. And then we also have about a half an hour of time just to go over some introductory stuff before our first patient is scheduled. And all residents and faculty members refer patients to the OMT clinic, which is really cool as well. And I especially love it when we get a referral from one of the MD residents and that patient happens to be scheduled on the day that they're assigned to OMT clinic. That's just really cool that they also get to kind of use their hands in ways that they've never necessarily done before. And it's a lot of, you know, we're not asking MDs to start like cracking necks or anything the first time they're in OMT clinic. So we do some really basic stuff, but stuff that's very feasible for you guys to all learn.
Okay, that's cool. So you kind of touched on this a little bit, but how often do you get to go to the OMT clinic throughout your years? Because I think it sounded like DOs get a little bit more time there, but if we wanted to, could we spend more time there just to kind of hone some skills and learn a little bit more? Because I know nothing about it.
Yeah, that's a great question. And I'll ask it because I'm not sure Marco actually knows the answer. So all interns get scheduled at least once in their intern year, and then would be getting scheduled at least once as well in second and third years is currently kind of how it's mapped out. And like I said, I do anticipate the frequency increasing once we have another faculty member because we'll add it to our rural clinic. So currently, when you're on your community medicine rotation as an intern, you get assigned to OMT clinic, and then the DOs automatically get kind of filled in some extra, but then when you come in, if you request to have extra sessions, our resident scheduler will try to add you in for extra sessions. You also get assigned to OMT clinic when you're on sports medicine, ortho, and then also when you're on ambulatory medicine as a third year. So there's a variety of rotations where it's automatically built into your schedule, but then for folks like our integrative medicine folks, they've all kind of asked to have extra OMT sessions. And then there's just some other folks who just have an interest. And so we try to plug them in for extra as well. And I will say too, there are a couple of techniques that, you know, if you've kind of seen one, done one, and then can teach one, we can sign you off kind of like as a competency that you could do some of the more basic treatments in your own clinic session, and the faculty are able to, the faculty go through faculty development, even though they're MDs. I work with them on a regular basis to also develop their skills and understanding, and they trust me that I say people are competent, and so they can also precept you when you're in your office hours seeing patients.
Thanks so much. Kind of jumping off of that, for allopathic students, like, excuse me, sorry, given the training that like you have integrated into the program right now, what are the, like, just a few examples of the kinds of things that we might be able to learn well enough to kind of take with us after residency, as people kind of not knowing anything about it going in? Because I think it's really cool to, you know, the prospect of learning about it.
Marco, do you want me to take that one too? Okay. Poor Marco, he hasn't had OMT clinic yet. He's just one of those guys working on folks in the middle of the night. So one thing that any and all of you can do is called the suboccipital release. And that is really awesome for, I actually start every OMT session with patients using suboccipital release, because I feel like I like to, you know, our whole entire musculoskeletal system is connected. And I feel like if I start up here and I can release what's going on up here, it sets the tone for the patients to relax. It really eases up all of the, you know, tension in their head and starts down into their neck, so that everything else is going to kind of start to fall into place. So suboccipital release I use just sort of as a prep and relaxation technique, but it's also really great for headaches, both acute and chronic headaches. It's really great for sinus stuff. There are some techniques even with babies who are having breastfeeding difficulty and whatnot. So that's definitely the one thing that you can all learn. Another technique that is very easy to learn is we call them myofascial techniques or soft tissue techniques, which is very similar to a lot of like massage type stuff. And that's also things that that we can teach you fairly easily. There's also muscle energy techniques and counter strain techniques, which I think are pretty easy for most folks to learn. I mean, they may not be doing muscle energy on like the entire spine, but there are certain or extremities, but there are certain muscle energy techniques that you guys could learn and then replicate. And I think part of my goal is that you'll have a few techniques that you could do in your office with patients or in the hospital. We do some lymphatic techniques as well that really help in terms of like healing with respiratory illnesses that we like to do, or I like to do on the inpatient side of things. but I think another goal is to also understand, similar to how when you're in med school and residency and you have to do a surgery rotation, you're going to use some of those skills. You're going to probably get a lot better at suturing. You may do some minor surgeries, but a lot of that is also learning how to counsel your own, knowing what to look for diagnosis. Is this an acute abdomen or not? But then also counseling your patients on other surgeries that they may be having or they may have had. And I think the stuff that you'll learn with OMM or OMT and OPP training is also like, when is it an appropriate time to rope in one of my osteopathic colleagues that one of my patients could really benefit from, adding that complementary aspect of their treatment. And so I think, those are the goals. Like, certainly there are additional courses that you guys could take to get OMT certified and do like the high velocity, low amplitude, which is more of the cracking type stuff. We don't use, like, I may do that in OMT clinic, and the DO residents will do some of that in OMT clinic. I don't usually jump into that with the MDs. But there's opportunity out there to take, like, they call them like boot camps, where you can go and get that training as an MD and then get certified to do OMT. Our goal is just for you to have that initial exposure, feel comfortable with some basic stuff, and also know when it's a good opportunity to refer.
My brother is in school to be a physical therapy assistant, and I had a really bad neck ache, and he did the suboccipital release for me. Incredible. And the question I had as well, so you have the urban clinic and also the rural clinic. Where do residents generally choose to live when they're at LTH?
I think that's a question for Marco.
I can definitely answer that one. So I live about 3 blocks from the hospital in like the downtown Lancaster area. And my class has 13 people in it, and 11 of us live in the downtown area. I don't think anybody's really planning to move for next year. A few people bought houses. The classes above us, it's pretty split, like half and half. And it also kind of depends on life circumstances. Some people have partners who are doing residency in York or Philly, so they choose to live a little bit further out to make their commutes about equidistant, things like that. But I would say the majority of people live within about 10 minutes of the hospital, which is connected to the downtown family medicine clinic, just because we do so much stuff there during our first year. And then the second year, we start getting more time in the Quarryville office. But like Kirsten said, that's really only like a 25-minute drive, and it's not really trafficy from what I hear. It's very like a country kind of road. So it's like a nice drive to kind of recenter and not have people talking to you. So yeah, I'm looking forward to that drive a little bit next year, because I currently walk to work and I miss listening to music in the morning and stuff like that.
Marco, how are you adjusting to intern year? What are some of the challenges you've been going through? Like, what kind of things are going through your head?
Honestly, I was expecting it to be a little bit more of a change. Like, I was expecting to be like so overwhelmed, but I mean, all in all, I feel super supported. And I mean, there's a lot of things I don't know, like the majority of things that I don't know right now, but it's so great not feeling afraid to ask questions, and being able to go to my upper years, and then if they don't know, being able to go to an attending the same way I would go to an upper year is just been super great, and really kind of calmed a lot of my fears I had coming in, just because residency is such a large step up from where we were as med students. We're taking on a lot more responsibility. We're taking on a larger role, and it's definitely a challenge. But I don't think that I've come home yet like super overwhelmed. Like, there's been great days and there's been days that were like fine, but I I think just going in with a positive attitude every day and having the support of my co-residents and faculty has just been really what was kind of like the icing on the cake coming to this program, especially with like the virtual interviews last year. I never got the opportunity to rotate here. I didn't get the opportunity to meet these people in person, and I was very apprehensive about like what the culture would be like. And it's just been amazing. I feel like I lucked into the best possible option. So, yeah. And I didn't fully answer your question. I just realized you asked like what the biggest challenges have been. I would say like probably the biggest challenge is kind of adjusting your expectations of where you're going to be in this point in your career. I think I had an idea going in that like I would pick everything up super quickly. Like I would see things like one time and be able to like manage things on my own. And I'm learning, you know, it takes a little bit more work than just seeing stuff one time for me anyway. Just because every patient's a little bit different. So what you did for one person might not work for someone else. So I think just like adjusting that expectation has also really helped keep my attitude pretty positive and realizing, you know, like, oh, I might not be exactly where I thought I would be by this point, but my colleagues feel the same way, and we're all getting through it together and learning more each day. I think that's the craziest thing I've learned so far is, you know, every shift I walk away knowing something that I didn't before, and like taking those real small victories is kind of what you got to live on right now, and that's okay.
And you're 7 weeks more advanced in your career than you were, right? So it's actually really I think one of the pivotal moments is when you either we don't have interns supervise medical students or work with medical students. We wait until you're a second year, but once you're a second year and then you're supervising an intern or you're working with a medical student, there's this like major moment of like, oh my gosh, like I've learned so much in the last year, because you realize that folks who are in your shoes as med students and brand new interns, you know, they're trying to figure out all the things in the beginning. But I would echo what Marco said. Like we have great residents. They really support each other. And I think our faculty, I lived through it and was really excited to come back and join faculty because it's a great group of people, if I don't say so myself. But I feel like we're a really one big happy family, trying to all support each other and leave no one behind. So there's just really a collegial effort to make sure everyone's well cared for and everyone's learning on the right trajectory. And so that's been great. Any other thoughts or questions you guys have? There's no rush. We were kind of, I think, booked till 7:30, but there's no rush for us if you have anything else that's come to mind. I think Sarah asked if each of you could put your email address on our little Sign Up Genius link in the chat box. That way we can kind of keep touch with you. I'll actually put my email address in the chat box right now as well. Feel free to email me with any questions, and we'd love to see you guys at more hot topics and on the interview trail.